topic is the radial nerve. So it is the main nerve of the upper limb, as well as it is the largest nerve in the upper limb of the human body. And secondly, it is the largest branch of the brachial plexus. So brachial plexus is the main group of nerves which supplies the overall upper limb. So radial nerve is one of the nerve which arises from this brachial plexus. So see the origin. So it is actually this brachial plexus have three cords in it: lateral, posterior, and medial cord. So this radial nerve arises from the posterior cord of the brachial plexus. Coming to the termination of the radial nerve, it terminates by dividing into superficial and deep branches in the forearm. So now we can see the causes of the radial nerve, how it arises, where all it goes and supplies various muscles, and how it terminates. This means the causes of the radial nerve. So first, it arises from the posterior cord of the brachial plexus. So the main root is the C5, C6, C7, C8, and T1. So it arises and enters the axilla. See, axilla. In axilla, we have the axillary artery. So, axillary artery is the main content of the axilla. So, this radial nerve lies posterior to the third part of the axillary artery. So, then in the axilla, it gives three branches. So, the branches of radial nerve, we will see it later. So, then after giving the three branches, it enters into the um, arm at the lower border of the teres major. Then it runs in the spiral groove. So this spiral groove is presented in the humerus bone. So this spiral groove is mainly related to the radial nerve. So this radial nerve passes in the spiral groove and it gives five branches. Then below to the groove, it appears in the lateral muscular septum and reaches the anterior compartment of the arm, and there it gives three branches. Then later it enters into the forearm and it gives the terminal branches, such as superficial and deep branches. These are the causes of the radial nerve. Now we have to see the branches of the radial nerve. So here we can see the three branches, and from the spiral groove 5 branches, in the anterior compartment 3 branches, and the terminal branches. So we can see what are the branches of the radial nerve. So as we know, it arises from the roots of cervical and thorax, such as C5, C6, C7, C8, and T1, and it enters the arm, and in the as it enters the axilla first, so then it gives the three branches. What are the three branches of radial nerve in the axilla? So what are they are: posterior cutaneous nerve of arm, and long head of triceps, and medial head of triceps. As we know, this triceps muscle have three head in it. One is long, medial, and lateral. So long and medial is arises from the axilla, is supplied by the radial nerve in the axilla, whereas the lateral head of triceps is a branch which arises in the arm. The radial nerve branch is from the arm. So first in the axilla it gives three branches: posterior cutaneous nerve of arm, long head of triceps, and medial head of triceps. These are the three radial branches in the axilla. Coming to the arm, we have first it enters into the spiral groove. So in the spiral groove it gives five branches. What are the five branches? It means that lower lateral cutaneous nerve of arm, and nerve to unconscious, and posterior cutaneous nerve of forearm, and medial head of triceps. So these are the five branches. See, lower lateral cutaneous nerve of arm, lateral head of triceps, nerve to unconscious, and posterior cutaneous nerve of forearm. These are the five branches. So then later, just below to this groove, it appears the lateral muscular septum. So then it gives three branches: brachialis, brachioradialis, extensor carpi radialis ulnaris. So these are the three branches from the radial nerve just below the lateral intramuscular septum. After it pierces the septum, it gives these three branches. Then entering into the forearm, it as I said, it terminates here by dividing into superficial and deep. So this is the superficial. So this is the deep branch of radial nerve. So this superficial is actually a sensor nerve. So it as it passes through the tendons of the brachialis and the tendons of the anatomical nerve works in the sense, as we saw, third compartment and the first compartment of the extensor retinaculum muscles tendons. Okay. So coming to the deep branch of radial nerve, it mainly supplies the extensor muscles. So extensor muscles in the sense, all the extensor retinaculum compartment muscles, such as first compartment muscles is the uh, abductor pollis longus, extensor pollis brevis, and the second compartment is the extensor carpi radialis brevis. The extensor carpi radialis longus is supplied in the arm itself. So whereas third compartment is the um, extensor pollis longus. Then fourth compartment muscles, only we have to write it here. So muscles are the extensor digitorum, extensor indicis, these two. So then coming to fifth compartment, extensor digitorum minimus. Sixth compartment, extensor carpi ulnaris. So extensor muscles are supplied by the deep branch of radial nerve. And then in the cubital fossa, so this radial nerve is gives a branch to supinator muscles. So normally these are the branches and the muscles which is supplied by the radial nerve. So coming to the anatomical or the clinical significance of the radial nerve, as we know that this radial nerve passes through the axilla, passes through the spiral groove, passes in the elbow joint. So when the radial nerve injured at these specific regions, what are the clinical aspects or what are the consequences it gives? So at the axilla, when the radial nerve is compressed, it leads to the crunch palsy. Crunch palsy is nothing but, see, axilla is the when the radial nerve is get compressed at the axilla, so the whole upper limb gets affected by it. So there is loss of extension. As we know, the radial nerve mostly supplies the extensor muscles. So extension of all the joints will be lost. So features are the loss of extension of elbow joint, loss of extension of wrist, which leads to the wrist drop, and loss of extension of the digits. So these are the clinical features of the crunch palsy. When coming to the spiral groove, when the radial nerve is damaged in the spiral groove, it leads to Saturday night paralysis. It means that the during night time, during sleep, the position of the upper limb is not in a correct manner or it may be compressed. So it may lead to loss of extension of wrist and digits alone, not about the elbow joint. So coming to the elbow, the radial tunnel syndrome is occurs when the radial nerve gets compressed. It means that mainly the deep branch of radial nerve is compressed during at the elbow joint. So loss of extension of wrist and digits will be taking place, but there is no wrist drop in the sense because the extensor muscles of the wrist is supplied already above the elbow joint itself by a branch of radial nerve. So when the radial nerve is compressed in the elbow joint, it does not lead to the wrist drop. So these are the main clinical significance of the radial nerve. Thank you.